Some years ago, I knew a woman who went on vacation in Mexico. While there, she cut herself and needed stitches. She went to a clinic in a small town and got the treatment she needed, no charge. Ever since I heard that story, I have felt that we need to do something like that in the U.S. To some extent, it is already happening with drop-in clinics in stores. It's a good idea that needs to be supported and expanded with some help from tax dollars. It doesn't have to be too fancy. All we need is a simple, clean storefront staffed by a nurse practitioner. She would be able to diagnose and treat minor problems. She would have access to a computer system that would help her decide when someone needed to be sent elsewhere for further treatment. This would also solve the problem of crowded emergency rooms that are overwhelmed by people with minor problems. This doesn't need to add to our healthcare costs. If we simply decide not to spend hundreds of thousands of dollars on extreme care for patients who will die anyway, then we can free up enough money to provide basic care for everyone. I know this sounds tough. We are at the point where tough decisions have to be made. Many people with many years of life ahead of them are suffering because we are wasting money on people with a very short life expectancy. This is a perversion of values, and we need to change it. A lot of our health care dollars are being spent on people who don't take care of themselves. They smoke, get drunk, eat bad food, and drive their cars from door to door rather than walking. In the present system, we are subsidizing all of those bad habits. Why should we? Accountability is the new order, and everyone should be responsible for making a reasonable effort to maintain their health. If they don't, it's not our problem. The fact is, you are already paying for national health care, but you probably don't get it. That's right. If you work, money is taken out of every paycheck to finance Medicare. I'm paying $1,500 a year for Medicare, which is half of what it costs to provide a national health service in most of Europe. On top of that, I pay thousands of dollars a year for private health insurance, which I rarely use. I'm fed up, and I'm not happy with the weak programs that are being offered by most politicians. It's time for a major change, and it's time for you to call Congress to demand a change.